Ever noticed a strange lump in your groin or pelvic area? It can be a little unsettling, right? These lumps might seem small, but they could indicate something more significant going on. Let's break down exactly what might be happening under the surface, why it matters, and when it's time to call a doctor. Part 1. What's in the groin area, and why do lumps appear? The groin area contains more than you might think. It's not just skin and muscles, there's a network of lymph nodes, blood vessels, nerves, and other tissues. With all these structures so close together, a variety of conditions can cause lumps to form. These can range from harmless cysts to more serious issues like hernias or blood vessel abnormalities. So if you feel something unusual, don't ignore it. Part 2. Common causes of lumps in the groin. Cysts, a bump that may come and go. Cysts are a pretty common cause of lumps. These are non-cancerous, fluid-filled sacs that develop under the skin, and they are generally harmless. The two main types that can appear near the groin are epidermoid cysts and sebaceous cysts. Epidermoid cysts, think of these like tiny, under-the-skin pouches filled with a white protein called keratin. You may feel a firm, movable nodule. Sebaceous cysts, these form when a hair follicle or sweat gland gets clogged. Unlike epidermoid cysts, they're filled with a yellowish, oily substance. They usually stay small but can get irritated. In most cases, cysts don't need much attention. However, if a cyst grows larger or becomes painful, you might need to have it drained or removed by a doctor. Swollen lymph nodes, your body's alarm system. The lymph nodes in your groin help fight off infections. But if they become swollen, it's often a sign that something's off. When lymph nodes swell, it can indicate anything from a minor infection to something more serious. Common causes of swollen lymph nodes in the groin include infections. These can range from minor cuts to more serious conditions. Other illnesses, certain diseases, including some types of cancer, can also cause lymph node swelling. Hernias, when tissue pushes out of place. Another frequent cause of lumps in the groin is a hernia. This happens when tissue or part of an organ pushes through an opening in the surrounding muscle. Inguinal hernia occurs when part of the small intestine pushes through a weakened area in the lower abdominal wall. Femoral hernia, in this case, the tissue bulges near the inner thigh, typically more common in women. Signs of a hernia often include a bulge between the lower abdomen and the thigh, discomfort or pain, especially when moving, abdominal bloating or nausea. Hernias are often painful and may require surgery, especially if they're causing discomfort or are at risk of complications. Enlarged blood vessels, aneurysms and varicose veins. Blood vessel issues can also cause lumps. Two types of blood vessel problems that show up as lumps include femoral aneurysms and varicose veins. Femoral aneurysm. This occurs when the femoral artery, which runs down the leg, develops a weakened area that balloons out. Often, these aneurysms can be felt as a pulsating lump in the groin. Varicose veins. These are swollen or twisted veins that can cause bulges. They're more common in the legs but can also appear near the groin. While varicose veins are typically harmless, they may require treatment if they're causing discomfort. Femoral aneurysms, on the other hand, are more serious and often need medical intervention. Part 3. When to seek medical attention. Some lumps are benign and won't require treatment. But there are clear signs to look out for that indicate you should see a doctor, such as rapid growth of the lump, signs of infection, like redness, warmth, or swelling, persistent or worsening pain, nausea, vomiting, or fever. Ignoring these symptoms can lead to complications, and in some cases, delayed treatment could mean a more serious condition. Part 4. How doctors diagnose groin lumps. If you see a doctor for a lump in your groin, they'll start by asking about your symptoms, any family medical history, and will perform a physical exam. They might inspect a lump, press on the area, or look for signs of infection. From there, they'll likely order a few tests to get a closer look. Ultrasound, often used to check if the lump is filled with fluid or solid material. CT or MRI scan helps the doctor see the full structure of the lump and any nearby organs. Blood and urine tests, used to detect signs of infection. Biopsy, if necessary, a doctor can take a small tissue sample for further testing. These tests help pinpoint what's causing the lump so the right treatment can begin. Part 5. Treatment options. The treatment for a groin lump depends on what's causing it. Cysts. Sometimes, a cyst will go away on its own. If it doesn't, your doctor might drain it or remove it. Swollen lymph nodes. If an infection is the cause, antibiotics can help clear things up. In other cases, more intensive treatments might be necessary. Hernias. Small hernias can sometimes be pushed back into place, but surgery is often needed to prevent recurrence. Femoral aneurysms, typically treated with surgery to prevent rupture. Varicose veins. Options include compression stockings, endothermal ablation, heat treatment, and sclerotherapy, medication injections to shrink the vein. Remember, treatment can vary widely depending on your individual case, so it's essential to follow your doctor's advice. Part 6. Prevention and outlook. While you can't always prevent lumps, taking certain steps can help reduce your risk. Good hygiene. This helps prevent infections and cysts. Safe practices. Using barrier methods during sex can reduce the risk of sexually transmitted infections, which can lead to swollen lymph nodes. Regular exercise. Keeping your muscles strong can lower the risk of hernias. Outlook varies depending on the cause. Many lumps, like cysts and certain swollen blood vessels, resolve with minimal or no treatment. Hernias, if small, might not need surgery, but larger or symptomatic hernias often require it. However, with the right diagnosis and treatment, most people can expect a positive outcome. Conclusion. A lump in the groin can feel unsettling, but by understanding the possible causes and recognizing when to seek help, you can take control of your health. Remember, early diagnosis and treatment can make a significant difference. So if you ever notice something unusual, don't hesitate to reach out to a healthcare provider.